Hello everyone, my name is Bart and I'm here with Lauren. We're both first year dental students and today we're going to be having a really important conversation with you all. This is a question that frequently comes up in interviews and personal daily conversations, and it's two big words. Why dentistry?
Yeah, so today Bart and I will be sharing some of our reasons for deciding to go to dental school and for choosing dentistry as a career path. And we know that this varies so much between people, and it really is such an individual decision, but we wanted to share our paths to dentistry and also give advice to anyone who is in the position now of deciding whether dentistry might be a good career choice for them.
Yeah, I think that's a really important point, that everyone does have a unique path, and it's really important to not compare yourself to anyone else, because at the end of the day, if this is where you really want to go, if this is something that you really want to do, you'll make it, and it doesn't necessarily matter how you get there. Everyone who puts in the work will have this dream become a reality at some point. So we're gonna dive right ahead into the episode and talk a little bit about what led us to becoming first-year dental students. Okay, Lauren, so why don't you just go ahead and talk a little bit about your path to dentistry and some of the experiences and things that kind of led you into this path?
Sure. So I have basically, for as long as I can remember, have always been interested in healthcare. It's always something that I imagined myself doing, but I was never really sure what path I wanted to take within healthcare. My dad is a physician, so I was exposed to that early in life. And I also loved animals, so actually for a really long time I wanted to be a veterinarian. But as I got older, I started to think more seriously about what path I wanted to follow within healthcare, and I started to think about dentistry more seriously. And part of the reason why was that I had so many experiences at the dentist's office when I was younger. I had braces from 2nd grade until 7th grade, so that made a really big impact on me. I had a lot of procedures done, and throughout all of these experiences, I had dentists who were really good role models and who talked very positively about the field. So I started to consider dentistry more seriously, and during my first year of college, I started shadowing. So I shadowed my friend's father, who is a dentist, and I really loved everything that I saw that day. I loved the way that he ran his office. I really liked the hands-on nature of the work. I also really loved the relationships that he built with his patients, and just the entire camaraderie of the office was just really nice to see. So after that day, I kept shadowing. I shadowed different dentists, and I really started to see myself in dentistry, and I think it, to me, combined all my interests the best. So I wanted to work with people, so I decided against becoming a veterinarian. And there were a lot of things with dentistry that just connected with me more than medicine. And probably the most important factor were just my own experiences with dentistry. I felt that I could really relate well to patients because of our shared experiences.
Yeah, that's really great to hear that an example of someone who didn't know they wanted to be a dentist from day one. It goes to show how important these experiences are, shadowing and kind of getting your hands wet in the field, because that's really gonna give you an idea of what it's like to be a dentist day to day, kind of get a better understanding of what the relationships are that you're forming with your patients, get a better understanding of the types of procedures that you're doing, how you're interacting with people. So that kind of just goes to show that not everyone knows they want to be a dentist from the get-go. They can kind of have an early interest in healthcare, but certain factors would steer them from going to, like in Lauren's case, from having early exposure to her father, who's a physician, to maybe possibly wanting to be a vet. But these experiences, as she was explaining with the dental shadowing, really helped her commit to this path.
Definitely. I think shadowing was really, really helpful, because that is the best way for you to see if this is the kind of work that you want to be doing day in and day out. And also was very helpful for me to talk to the dentists who I shadowed and just see if they were happy with their job, what advice they had for me. All of that really made a big difference in helping me decide on dentistry.
Now, let me ask you a question. Did you ever shadow any physicians or vets?
I did not formally shadow any vets, and for physicians, I worked a bit in my dad's office, so that kind of gave me some experience seeing what life was like as a doctor But really my most times shadowing was spent shadowing dentists.
Awesome.
Yeah, so in my case, I was not sure about dentistry from an early age, but I know you were interested in the field very early on. So can you talk a little bit about your path to dentistry?
Yeah, of course. Like you said, I had a very early interest in dentistry, and essentially becoming a dentist is what I've wanted to do for as long as I could remember. Growing up, I had a lot of dental issues. I constantly got cavities and constantly had to go to the dentist. And because of that, I formed a really close relationship with my pediatric dentist. And every time I would go into the office to see him, I would get really excited because he would explain to me what he was doing. He would show me what the tools looked like, how they functioned. He would position the mirror in a way that I could see what was going on in my mouth. He would let me look at the x-rays. And he really made me just feel super comfortable in the dental chair, which is super rare, in my opinion, for a child to feel that sort of way, because there's always this innate sort of feeling that children have this terrible fear of the dentist, but I learned, in my case at least, that necessarily wasn't true. So I kind of looked to him as a role model and kind of hoped to emulate that sort of behavior when I was older, and I kind of looked up to him going through high school and going into college, and I kept telling him every single time I would see him that, yeah, I still want to go to dental school. I'm still really interested in this. But at the same time, I knew it was important to keep my mind open and not be super narrow on one particular thing, because that could potentially allow me to lose out on other experiences. So going in through high school, I knew I was really interested in sciences, particularly I really liked chemistry. And going into college, I knew I wanted to major in something science related, and I ended up majoring in biochemistry. But my freshman year, I was kind of thinking, okay, there are a few different fields I can go into with STEM. I was thinking potentially being a high school chemistry teacher. I really liked mentorship and teaching. And I thought that's kind of an age group I would want to work with. And another idea that I kind of played with but didn't really pursue it too seriously was maybe keep my mind open to engineering, a profession where you use your hands, that it's very cerebral, it's very STEM heavy. But I kept coming back to this idea of wanting to be in healthcare and wanting to become a dentist and kind of forming close relationships with patients. So I decided to start shadowing dentists the fall of my freshman year of college. And I would just, when I went back home for breaks over Thanksgiving and winter break, I would shadow a few dentists. And I didn't do anything too seriously, a few hours here and there, just to kind of have some conversations with dentists and see what they thought about their profession, see what their daily lives looked like. And it wasn't really until the summer of the year going into my sophomore year of college where I really committed to pursuing the field of dentistry. And that's when I spent a week in rural Virginia on a remote area medical trip, RAM for short. And RAM is a nonprofit organization that's committed to providing free oral care, free medical care, and free vision care to underserved and rural populations of the U.S. And I got the opportunity to speak with a lot of patients in the dental wing and talk to them about their experiences with their oral health. And a lot of these people never really had the opportunity to see a dentist. A lot of these people were waiting in line for days before the clinics were opening. People were hiking overnight because not all of them had access to cars. So you really see they were waiting an entire year for this one opportunity to receive the care that I myself might consider just a regular procedure, a routine procedure like a filling or a cleaning, but for them, these procedures were a luxury. So that's when I really kind of committed to becoming an oral physician that provides care to those who need it most. And that kind of motivated me through college, through studying for the DAT and applying to dental school, because I kept coming back to that experience. And it has honestly motivated me so much to kind of continue through this path.
Yeah, that's really interesting. And so it sounds like we both have the shared experience of having really good role models within dentistry and having really positive influences in dentistry early on. But you also had your shadowing and your volunteering.
Right.
So what ultimately led you to choose dentistry then over becoming a teacher or becoming an engineer? Was it just the fact that you kept sort of going back to dentistry?
Yeah, I guess it was. I want to stay away from saying it was like this natural calling and something that I believe deep down inside that I was meant to do, but I honestly quite feel that way. I think about the qualities that a lot of the great dentists that I've worked with and shadow with in the past exhibited, and that's kind of being charismatic, wanting to work with your hands, being type A personality, kind of wanting to see the work that you do manifest in front of you. I keep thinking about those quality traits, and I really see those in myself, and I honestly just think it's a profession that's meant to be, for myself at least. Yeah. And how about you? What kind of stands out about dentistry that some other health professions might not have? Because I remember you had said that you really did want to work in healthcare from a young age.
Right, that's a good question, and it's a question that comes up very often during interviews. If you're interested in applying to dental school, you'll definitely have the question of why dentistry, and then why dentistry over medicine, or why dentistry over any other field in healthcare. So for me, it was a few things. I think the biggest influence for me was the fact that I had had so much dental work done myself. So it had really impacted my own life. It impacted the way that I carried myself and my confidence a lot, because when I was younger, I was so insecure about my smile, and dentistry really changed that for me and changed my confidence. So that was a big factor for me. But there were also other factors about dentistry that I liked. I really liked the hands-on work and just being able to be more creative. I think that sort of lines up with my personality, because I like science, but I also like to create, and I like to make things that are aesthetic and visually pleasing, so you can definitely do that in dentistry. And then I also considered sort of the lifestyle that I wanted to live. I'm interested maybe in owning my own practice one day, possibly interested in teaching or mentoring, and those are all things that I can do within dentistry while still having a good work-life balance, which to me is also something that I value really highly.
Yeah, that brings up a really good point there. A lot of people kind of see dentistry as this one-faceted profession where patients kind of just go into the office and the dentist essentially is just there to drill, bill, and fill, you know? But there's so much more to dentistry that if you kind of just spend more time educating yourself about the profession and understanding what goes into making a dentist, there's so many different branches you can take your career. And Lauren was kind of alluding to this, saying that she wants to potentially own a practice in the future. That's something super unique about dentistry that you might not be able to get in medicine or with veterinarians. You have the opportunity to become a business owner if that's something that you're really passionate about, opening a practice with your own vision, managing people and a team essentially in the way that you want it to be run. And I think that's a super amazing opportunity, especially within healthcare. You can kind of direct and treat patients the way that you see is the most fit. And another example of a different path is education or potentially going into academia. This is definitely, I think, a field that is growing a lot more now. There are a lot more programs out there that are offering like advanced graduate educations and dentistry education specifically. And I think this is an amazing opportunity for those who wanted to teach, but also kind of wanted to have a career in the health professions. You see this a lot with medicine, like medical education. And I think now dentistry is starting to adopt that. So you can also have a split career where you're practicing half of the time being in the clinic versus, but at the same time, you can be spending the other half of your time teaching and working with pre-doctoral students and kind of training the next generation of dentists. So there's so many different fields within the profession. And it's pretty much up to you in the direction that you want to steer that.
Definitely. Yeah, that was a big factor for me, was just thinking that within dentistry, I can really pursue the kind of career that I want. I don't just need to do clinical practice. I can sort of combine that with my other interests. And even within the dental specialties, if you choose to pursue a specialty, there's a lot of differences. So in some specialties, you'll develop longer-term relationships with your patients. In others, you'll just see a patient maybe 1 or 2 times. Also, depending which specialty you do, you can work with different age groups. So I really liked having all of those options and just getting to figure out which option best aligns with what I want to do.
So you bring up this interesting idea and concept of possibly specializing and how there's a lot of different routes there. Have you thought about any specialties that you might want to go into in the future?
Yeah, I've thought about it a little bit. I really wanted to enter dental school with an open mind and not really close myself off to anything, because I think there's so much that I'll learn here and see, and I could definitely change my mind. So right now, I basically have an open mind, but the specialty right now that interests me the most is orthodontics, and that's because it's the one that I have the most familiarity with, and I like a lot of things about orthodontics. I like the age groups that you get to work with. I like the treatment planning aspect. I think that would be really interesting for me, but I'm very open to seeing what interests me most as we learn more about dentistry. What about you? Have you thought about specializing?
Yeah, so I also really like the idea of specializing, kind of being a master of a few particular procedures, because there's a certain level of complexity that's involved with the specialty procedures that not a general dentist would necessarily be able to take upon oneself, because they might be a little bit beyond their scope of training. However, that being said, I will be working after dental school for a little bit of time as a general dentist to kind of reinforce that toolkit that you get as a dental student. So doing crown preps, doing fillings, doing root canals. So I'm going to be working for a little bit of time to kind of solidify that skill set. And then after I work for a few years or so, I'm planning as of now to potentially go back to school, and I'm really interested in perio. I've had some experiences assisting periodontists in the past. I really like how surgical it is, but at the same time, the other specialty, oral surgery, that takes a lot of time to kind of get a degree in oral surgery, because you essentially have to go back to medical school and do a lot of extra time and spend a lot of extra money to kind of get that certification. So perio offers that balance between surgical. There's a lot of research that's involved in periodontics, and there's a lot of research out there about the link between gum health to your overall health, So I kind of see myself working in that field a little bit, and with that research background, that might potentially help me kind of get into academia a little bit, or administration. So it's kind of all up in the air right now. I kind of want to take it day by day. At the end of the day, I kind of just want to make sure I'm forming great relationships with my patients, providing the best care that I can, and trying to keep my mind open. And who knows, 4 to 5 years from now, dentistry is so rapidly evolving. There might be another specialty that's out there that might interest me, or there might be new procedures or more complex protocols that are out there that might influence my decision. So I think it's important to kind of keep your mind open, and we're both only first-year dental students. So there's so much we still need to see.
Yeah, there's so much to experience still, so I think approaching it with that mindset is good. So what advice do you have for someone who is deciding if dentistry is something that's right for them?
Yeah, I think a few key factors. One, you have to be certain that working with your hands is something that you want to be doing for the rest of your life. Like Lauren was talking about earlier, I think dentistry is a very artistic, it's a very creative, and it's a very hand-heavy profession. You are essentially going to be sitting down, working with patients, and kind of enforcing those hand skills that you have developed over the years of training. So if you don't see yourself working with your hands a lot, if you see yourself talking a lot more to patients, or thinking about, different treatment plans that isn't necessarily dental related, then dentistry might not be right for you. Another thing is, I don't know. Good question. I'm going to turn that back on you, Lauren. Any pieces of advice or?
Yeah,
reasons?
I think the best way to find out if this is the field for you is to shadow and see what life as a dentist is like, and see if you can picture yourself doing the work that you see every single day. If you find it boring or not interesting, it's probably better to shadow different fields and see if those are more interesting to you. But this is what you'll be doing every day, so definitely good to shadow. Definitely recommend asking questions when you shadow, not just about the procedures you're seeing, but also about the lifestyle of a dentist and things the dentists you shadow wish they had known before they entered the field. I think that's a really good question to ask, that can give you a lot of insight.
Definitely.
And then also I think just reflecting on what matters to you in a career and what type of lifestyle you want, how much interaction with people you want. You definitely need to be a people person to be a dentist, because you'll be interacting with people all day long, and many of these people probably won't be super excited to be at the dentist's office, so I think it helps to have the kind of personality that can put people at ease and make them excited to visit the dentist. And then one last thing that I considered was just reflecting on my personality and reflecting on how much emotional weight I think that I can carry. And that was a big factor for me to choose dentistry over medicine, because in medicine, you see a lot of very serious illness, and you have to deal with things that are very heavy, like death. And I just personally felt that that wasn't best for me. I wanted to make a difference to people's health and interact with patients and take away their pain, but I didn't want to bear some of the emotional weight of medicine. So I think really just reflecting on like the kind of person you are and being really honest with yourself can be helpful when you're making that decision, especially if you're between dentistry and medicine.
Yeah, I really appreciate you for saying that last part. I think that takes a lot of vulnerability to kind of admit something like that, and I definitely agree. I think that's really true for myself as well. Within medicine, there are a lot of fields where you have to deal with difficult decisions, and not to say that's not true about dentistry as well, but the emotional burden of having patients potentially die under your care was something that, quite frankly, I didn't want to have that responsibility in sort of a way. So I think dentistry was still a great opportunity to be able to make a difference in people's lives and increase the quality of their life without kind of putting myself in a position where I feel like I wouldn't be able to thrive.
All right, thank you so much, Bart, for being here today, for sharing your experiences.
Absolutely, I had a great time. And hopefully this was able to help whoever is listening right now kind of determine if dentistry is a right field for them.
Yeah, hopefully some of the advice we gave and just hearing about our paths was helpful. It's a really big commitment to decide that you want to be a dentist, so it's definitely one to think about very seriously, but it's also a very, very rewarding field and a very rewarding decision when you do decide that that's the path for you. So if you have any questions at all or would like to chat with us, you can message us on our Instagram at crack.the.dat, or you can send us an email at hi@crackdat.com, and we're happy to answer any questions that you have. Thank you so much.